So our goal at Volta is to develop and commercialize AI software solution to guide cardiac electrophysiologists in their cardiac ablation procedures to improve patient outcomes. So atrial fibrillation is the most common cardiac arrhythmia in adults. It increases mortality, so it's a severe disease affecting approximately 12 million patients in Europe and 8 million patients in the US. The difficult part about AFib ablation and AFib management is to reach satisfactory outcome levels, especially if we consider the two different subtypes of atrial fibrillation patient population. Persistent atrial fibrillation, which represents the vast majority of AFib patients today, and also patients that have already undergone an unsuccessful ablation procedure and that come back for a second procedure. So if we look at these two populations, the jury is still out as the optimal ablation strategy. So essentially, a lot of progress has been made on how we ablate cardiac tissue, but the jury is still out on where ablation should be performed to reach a high level of performance and a low rate of recurrence for this type of procedure. And we come with a mapping solution to help physicians understand atrial fibrillation, understand the underlying mechanisms, and adapt their ablation strategy to improve the outcomes of the procedure. So our technology is based on AI algorithms that analyze intracardiac data measured by catheters inside the heart. And this intracardiac data, which are mainly signals, obviously the quality of this data is instrumental for the quality of our analysis. And so we have launched a partnership, technical collaboration agreement with GE Healthcare, which is a long-lasting, important stakeholder in the field of EP. And we are partnering to have our system communicate with their system, which is an EP recording system. And we hope that we are able to be in a position to bring a technology that will make an important difference in terms of the workflow for physicians, but also in terms of the procedure itself, and in the end of patients' outcome with this collaboration. So we are partnering with signal quality experts at GE Healthcare to enhance our solution and to enhance our analysis. So the key takeaway is that AF, atrial fibrillation, is a severe disease for which the jury is still out in terms of the optimal ablation strategy. We are coming up with a solution that helps adapt and identify the optimal ablation strategy and therefore improve patients' outcome after a procedure. And we have just launched a technical collaboration with GE Healthcare, who really is a signal specialist in EP, to enhance further our solution and optimize the procedure workflow.